Hi, I'm Dr. Jory Fleischer,
And I'm Sarah Mitchell-Chen.
and welcome to Rush Recaps. So this is the next in our series of short educational videos based on questions that we hear from you, our patients, care partners, and families, frequently asked questions. And this is supported by a grant from the Parkinson's Foundation to improve team-based training in palliative care to improve the lives of people with Parkinson's. So with that, our topic today is advanced directives. What are they? Why are they important?
That's such a great question. What are advanced directives? They are various forms that allow you to express your wishes and preferences across care. And they're really important because it allows you, the patient, or myself, or Dr. Fleischer, or any of our family, to identify what they would want to have happen. So that's more broadly. And then there's a few different kinds of advanced directives. So one of the big ones that can be really helpful is in a power of attorney for healthcare. This will allow you to identify who you would want to have help you make decisions in the event that you're not able to make decisions for yourself. So that might be that you need to have surgery and you're going to get a little anesthesia. And so there's going to be a period of time where you're not able to speak for yourself. So that would then allow you to identify who would you want to have help speak on your behalf for your medical decisions. And the form is really important because the way they're designed is this complicated word called a surrogate decision maker. Essentially, who would step in to make the decisions on your behalf that would align with the type of decisions you would make for yourself. So it's not necessarily me stepping in for Dr. Fleischer to make the decision I would want to make. If I were Dr. Fleischer's power of attorney for healthcare, I would need to think about what Dr. Fleischer would want for herself. And that's a really important distinction. So when you think about who you would want to maybe identify as your power of attorney for healthcare, you're going to want to think about, are there people that are important to you around you in your life who you think could step in and be able to bridge that gap and identify, this might be what I would want for my loved one, but knowing my loved one, I think they might want this other thing. And I can tolerate being able to make the decision that they would want to have make. The other thing that can be helpful when you're identifying who's going to be your power of attorney for healthcare is you can identify a primary person and maybe a secondary. And we often recommend that you pick people from different generations in case things change over time and you need to have people lined up. You generally are not able to identify two primary decision makers. That's not the way the forms are written, but a primary and a secondary. And I think you can even make a third if you feel so inclined. But these forms are really important. You want to do them ahead of time, put them away. Once you've completed them, give them to the people that you've identified to be your decision maker, and then put them away for safekeeping. But they're something that, and then revisit them periodically to make sure that they're still consistent with what your wishes and preferences might be. So that's one type of advanced directive. And then there are some more specific advanced directives that we may want to think about as maybe we progress through an illness or progress in age or over time. A living will is another form that may allow you to say yes or no to some specific types of treatment that may be considered a little more invasive, and it can be a supplement to your power of attorney for healthcare. So the living will can look a little different depending on the state you're in or the attorney that helped you write it, but generally you could say like, I would or would not want dialysis, for example, or I would or would not want a feeding tube. Things like that, chemotherapy. It allows you to give a little more of a framework to that power of attorney for healthcare to say, these are some of my wishes and preferences. And then another form that we sometimes think about later in the course of an illness is what's called a POLST, a physician order for life-sustaining treatment. That, in the name, needs to be completed with a physician because it does need a physician's signature. And it will, again, allow you to then be more specific about what your wishes and preferences might look like for care. Would you want to have CPR and chest compressions? Would you not? Would you want to be intubated? Would you not? Or hooked up to a breathing machine or a heart machine or something like that. These may not be appropriate at different times of your life. That may not be something that you even would want to consider. You're saying, I'm healthy. I would, if anything were to happen to me, I would want to go to the emergency room and receive all the care that they can to address whatever the underlying concern is. In that instance, you don't need a pulsed.
Right.
But you might down the road decide something has changed and you're saying, I don't know that I would want all of that invasive treatment if I were to go to the hospital. And that's where a pulse can be really helpful. The overarching thing to consider with all of these advanced directives is having conversations with the people around you. What are your wishes? What are your preferences? What is consistent with what is important to you? What are things that you really wouldn't want? So thinking about more broadly, is time most important to you? Is quality of life most important to you? Is remaining at home most important to you? Those priorities and values can then really guide some of these decisions. And if you have questions, this is where palliative care or talking to your provider can be really helpful. If you have specific questions about what do some of these things mean? There's a lot of resources available online. A really wonderful one is called the Conversation Project. They can give you some guides of having these conversations with families. And many of these forms, a power of attorney for healthcare needs to be witnessed, but it doesn't need an attorney. It doesn't generally need to be completed with an attorney.
Doesn't need to be notarized.
In Illinois, a power of attorney for healthcare does not need to be notarized. In Illinois, a power of attorney for property does need to be notarized.
So I think that's a great point. Is sometimes people have filled out a power of attorney form, maybe with their lawyer, and sometimes there's power of attorney sort of for property, for financial stuff.
Mm-hmm.
This is different.
Correct.
Can it be the same person?
If that is the person that you feel you trust and you feel most comfortable with, yes.
But it could also be
different. If you had multiple children and one of your children was an accountant and you felt more comfortable with them managing the money, and you had one of your other children was in maybe the healthcare or allied professional field, that might be the person you would identify to be your healthcare power of attorney. So it's sort of thinking about who would meet these needs for you in the way that you would feel most comfortable.
And I think one thing that we also, talk about a lot is often when we're having conversations in the clinic about advanced directives, we tend to be focused on the individual, the patient, and typically they might be listing their caregiver, their care partner as their healthcare power of attorney. But I think something that we don't often have enough time for is asking the care partner, do you have a healthcare power of attorney? Because sometimes, particularly for partners, for spouses, they may be each other's. And depending on the condition that the loved one has, if time is going on and abilities are changing, if there's cognitive impairment, the care partner may need to kind of pull out that old healthcare power of attorney and may need to designate someone else instead of their loved one who might have cognitive impairment and no longer be the best person to speak on their behalf in case something happens.
That's a really good point. The other thing is these can be difficult conversations at times. People don't always want to have these conversations. If it's a couple or a family unit, sometimes you can have a party of doing your advanced directives, but that this is not necessarily then focused on the patient with a neurological condition, but that it's a thing that we're all going to do together to plan ahead and think about what's important to us, to take a little bit of the pressure off of maybe someone with the neurological condition and say, this is a good practice for each one of us, that myself, Dr. Fleischer, that, all of your providers, that we all should be doing an advanced directive to identify who we would want to have make these decisions. And then periodically, like Dr. Fleischer is saying, revisiting them to make sure that the person that's closest that you've identified is still accessible. Maybe someone has moved and we need to revisit that. I was joking with my dad, how far do I need to move so you would make my brother the power of attorney than myself? Just sort of thinking about these are important conversations to periodically revisit and to try to have earlier rather than later, especially in some of these diseases that may have a component of a dementia that may make it more difficult later in the course of an illness to complete some of these forms or tell the people around you what's most important to you. And really the biggest gift you can give, we all can give to our loved ones, is telling one another what it is that we might want so that they're not trying to guess or wonder about what it is, and for them to worry that maybe they're not making a decision that's consistent with what you would want. So
that little bit of planning and awkward and difficult conversations now save so much difficulty and heartache down the road. So it is a huge gift to be able to give to someone.
yes.
All right, and we will dive in another Rush recap to what is a DNR? What do those letters even mean? We'll get into the nitty-gritty of that in another video. So thank you so much for joining us. Please let your providers know if these are helpful. If you have questions that you would like covered in another video, feel free to share with family and friends if this will be helpful to them. Thanks so much.
Take care.